Good afternoon, everyone. For some reason, I have this arbitrary number in my head that when the participants hit 300, it's time to get started. I don't know where that comes from, but let's go ahead and get started as more folks virtually trickle in. I'm Dr. Sharon Milgram. For those of you who don't know me, I direct the NIH Office of Intramural Training and Education, and I'm really pleased to invite you to the 5th installment of our mental health series for biomedical researchers and STEM students. And the topic today is anxiety and anxiety disorders. I'm really pleased to be joined by Dr. Ana Ordóñez, who is the acting director of the Office of Clinical Research at the National Institutes of Mental Health. Ana and I served together on a mental health task force looking at the impact of COVID on the NIH staff, but also on communities beyond the NIH. And one of the silver linings of the pandemic for me has been an opportunity to get to know Ana. Ana will be joined in speaking today with Lori Chaikin-McNulty, who is a licensed mental health provider in the community who works with both young adults and adults in her private practice. But Lori and I work closely together in her role as a wellness advisor for NIH trainees. And she has been a really integral part of the expansion of our wellness program during the pandemic. So Ana is going to speak, and then Lori will speak, and then both of them will take questions. And then after that, for those of you who wish to stay and participate in a small group discussion, we will transition from one Zoom to another and get started with that. So it's been almost a year, and I think it's safe to say that we are all dealing with a great deal of uncertainty, grief, loss, confusion, and anxiety in so many different ways. And so it seems fitting that we gather once a month in an effort to support each other in both dealing with the pandemic, but also in thinking about mental health more openly and more broadly in the community. This is the series as it is currently scheduled. We are up to number 5 today. We will do depression and other mood disorders in March. All of these talks are archived on the NIH OITE YouTube channel, and you can watch them at any time. This is the link to the YouTube channel, and I want to stress for those of you who don't know a whole lot about our office, I want to stress that we offer many things beyond this program in career development, in leadership, in mentorship, in management, and we are really here to provide you with resources. So please check out the website, but also check out some of our other programs. We are almost finished with the fall-winter series of our Becoming a Resilient Scientist series, but we still have the program in February live. It will be in a couple of weeks. And all of these programs are taped and on the website. You can visit training.nih.gov for information. This is a program for students ranging from college students to postdoctoral fellows, just talking about how to withstand the ups and downs in scientific research and healthcare careers. If you want more information on OITE programs, you can follow us on Twitter or on Instagram. You can visit our website. And if you'd like a weekly email of what we offer for the biomedical research community, you can join this listserv here. So with that brief introduction, I am really pleased to turn the floor or virtual floor over to Ana, who is going to kick us off today. Thank you all for being here. I think it's important that we pause and really think about taking care of ourselves and each other. So I'm really pleased to welcome you. Thank you, Ana.
Great. So we can move to the next slide. Okay, so to get us started on today's talk, we're just going to start with a brief overview of what anxiety is, a little bit about the neuroscience around it. We're going to get into a few details about some of the anxiety disorders that we see commonly. And then we're going to move into Lori's talk, where we're going to speak about some more practical strategies and skills to manage anxiety. So just getting us started with what anxiety really is. So anxiety is an affect or an emotion that we all experience. It's something that is normal in the general population, and it has a lot of components to it that can actually be helpful and important to us to survive. It's good to try to distinguish the difference between anxiety and fear. They're definitely interrelated, and we can see that as well when we talk about the cognitive structures. But we think of fear as a response to an immediate external threat. And we differentiate anxiety from fear by thinking of anxiety as an internal state that occurs when the threat isn't there. So when we're anticipating the possibility of a threat, or after something has occurred and we continue to feel all of the emotions that come with that experience. It can also be, a response that would be expected in an external threat, but that becomes exaggerated, or that it continues a really long time beyond when that threat has shown up. We definitely can study fear and models of fear in animals. We often ask ourselves whether we can study anxiety in those same models because we obviously are the only ones who can really perceive what our internal experiences are. Next slide. So as I was mentioning before, it's not surprising that, we've started understanding the neurocircuitry of anxiety by looking at the neurocircuitry of fear. And this is really actually a more simplified depiction of the limbic system and of, the systems in the brain that are responsible for managing emotion regulation when stressors occur. So you could definitely look more in depth into the brain structures that are involved with anxiety, but for a general sense, I think it's important to think of structures like the amygdala, which you see at the bottom of the image, and how it interconnects with the prefrontal cortex. That's what the PFC is talking about, which is the center, that has more executive function over how we respond to certain behaviors and what kinds of things we can do, how we predict them. And it's also closely tied to the hippocampus. And again, this is just a place to start to think about all of the different systems in the brain. Some are ones where we have more conscious awareness of, some are, parts of the brain that are just responding immediately to a threat, whether or not we have control over what that response might look like. And I think that's relevant as we think about what things we can do to help manage our anxiety, and how strong and powerful it is that we can actually consciously take actions that then ultimately reduce some of the other responses that we don't usually feel we have the ability to control necessarily. Next slide. So we thought it'd be useful to think about the different types of anxiety. As I said, anxiety is a trait that's normally distributed in the population. Everybody has a certain amount of anxiety as a trait, and it can be actually very helpful and important for us for our survival. You can think of different situations like anxiety helping us pay attention to whether there are cars coming, while we're crossing the street. Anxiety helping us study for exams or pay our bills or be prepared for our job interviews and show up on time. Anxiety can be very important for survival, right? We stay away from a situation that might be very threatening, or things like defensive driving to make sure that we are preserving ourselves in, situations that might be dangerous. So anxiety can be adaptive. It's definitely something that we all have and that we all experience. Now, anxiety can also be maladaptive and very incapacitating. So we think of maladaptive anxiety as a state of very intense emotions or a response in our body that happens either in excess of what we would expect for a given circumstance, or in a way that's inappropriate to the type of stressor that's actually occurring. And I think one of the more important parts of that maladaptive anxiety is that it really creates a lot of stress and distress, and that really impacts our ability to function. Next slide. as we think about anxiety, I think this is a useful wave to think about anxiety, which we'll talk about anxiety as a wave in many different ways. This is one wave that's useful to think about in how anxiety relates to our ability to perform on different tasks. So as you can see at the bottom, if you have no anxiety, your performance is probably not going to be great. You're really not going to worry about getting any of your work done, right? And as you increase your anxiety somewhat, your performance may increase and you're doing better, you're more motivated, you're spending more time on whatever project you're performing. But at one point, right at the top of the wave, things start to get bumpy. If we have too much anxiety, then our performance on whatever task we're trying to complete starts to go downhill. And the more anxiety we have, the more it affects our performance. Next slide. So here are some other ways to try to think about that adaptive versus maladaptive anxiety. So if you look at the black wave, that's a way of thinking about the adaptive anxiety. So it recognizes that when we have a stressor, let's think of something that's happening right before that wave starts, an expected response for all of us is that we have some anxiety and that it goes up. And very importantly, that the anxiety will ultimately come down. As we think of maladaptive anxiety, if you think of the same situation, first of all, notice that those waves, the blue wave, not only lasts really long, but if you can see it, it starts anticipating that event from the very beginning. So the wave starts very much at the bottom where that 0 is. You're already starting to have intense anxiety before the stressor has even occurred. And then in that case, it's a type of maladaptive anxiety where it's really lasting far beyond when that stressor, which is that black line at the bottom, the time that you were exposed to the stressor has occurred. Another way of thinking, or a different type of maladaptive anxiety, is the red line, where the stressor occurs and the amount or the intensity of the anxiety is so much higher than what we would expect for that situation. Next slide. The other thing that's important as we think about anxiety, particularly when we think about it as a wave, is that the most common reaction and response to an anxiety-provoking situation is that we try to avoid the situation. Now, if you think back, there may be some really good reasons why avoidance is so much embedded in anxiety. For example, if we're walking in the jungle and there's some very threatening animal that might put us at risk, it would be very wise of us in the future to avoid that part of the jungle. And that is true for any number of common occurrences in our daily activities. However, one of the things that's really important to keep in mind is that although avoidance provides a very rapid relief, the next time you're exposed to the same type of anxiety trigger, what we see is that your anxiety response is much greater. So for example, if I'm learning how to drive and that makes me really, really nervous, and I start avoiding practicing my driving, the next time I sit in the driver's seat, my anxiety is going to be higher than the time prior. And if I avoid it for weeks and weeks, the next time I try it again, it's going to be even higher. The important thing to keep in mind is that the opposite is also true. So if I'm learning how to drive and I'm feeling really nervous, but I sit in the driver's seat and I practice and I go the next day and the next day and the next day, every time I experience that anxiety producing stressor, my anxiety wave is going to get smaller and smaller and smaller. Next slide. We want to keep track of how, anxiety is a normative trait that's in our population. And we can see that really well when we think of children and we think of our own development. For anyone who's been around a small child, you may notice that there's a very clear point in time where they're suddenly no longer easily passed from one set of arms to another because they start crying. And that's what we think of as separation anxiety. But if you think of different stages in our childhood into development, there are windows in which we expect different types of anxiety to kind of show up. As we get into our school age, school-related and performance anxiety, that window opens up. And I would say that that's a window that we see staying open for a much longer period of time. The same thing happens for, the types of anxiety or anxiety windows you can think of that open up during adolescence. So those types of anxiety are much more related to our performance and being rejected by our peers and social situations overall. I'm also looking at this green green anxiety at the top, the fear of negative evaluation. So I think that those are all types of anxiety that, you don't see in your 4 and 5-year-olds. It's definitely something we see happening during school age and opening up onward. And I would say something that we can continue to see into our professional careers. Next slide. So we're going to start getting into talking a little bit more about anxiety disorders. So no longer talking about that normative anxiety, but what happens when anxiety really starts to be a problem. So some of the common complaints, and I would say, these are pretty common across all of the anxiety disorders. Some occur more in some disorders than others, but they could occur in any of them. So obviously feeling anxious and worried, that sense of I can't stop thinking about, whatever that stressor is, feeling restless, fatigue, difficulty concentrating, irritability, muscle tension, agitation, difficulty sleeping, a number of different symptoms of the autonomic arousal, which we talked about a little bit earlier. So your heart beating really fast, your breathing gets really fast, you might get sweaty palms, and then other types of, what we call somatic complaints. So stomach aches, headaches, nausea, abdominal pain, they can all be symptoms of anxiety. Next slide. So there are many anxiety disorders, and there are some disorders that we have for a long time thought of as anxiety disorders that we recently, try to think about slightly differently, but I think they have a lot in common with anxiety. So we still have them on our radar when we're talking about anxiety. And that would be post-traumatic stress disorder and stress-related disorders, and then obsessive-compulsive disorder. As you can see, there are anxiety disorders that occur more commonly in childhood. And I'm looking at the left hand of the slide, like separation anxiety and selective mutism. And then there are those anxieties that are kind of correlated with those windows of anxiety we talked about before. So social anxiety disorder is more common as we're getting a little bit older. And then, panic disorder, generalized anxiety disorder, we're going to get into a few more details for each of those. Next slide. Okay, so things that are important for us as mental health providers, anxiety disorders are very common. They're more common than depressive disorders, and they really often go undetected. So it's important for us to make sure that they're on everybody's radar, including our primary care providers who we collaborate with. In many cases, and I would say probably in the majority of cases, anxiety disorders start in childhood and into adolescence. They're very common in our practices, especially in primary care settings, and about up to 40% of new referrals to outpatient psychiatry practices are for anxiety disorders. And something very important, and as a mental health provider, very reassuring, is that anxiety disorders can be treated very successfully, both in primary care, through working with therapy, and in other settings. Next slide. So just a little epidemiology. We have studies that are trying to look at the prevalence of anxiety disorders in different countries. And in a study that looked at 44 different countries, they found that the lifetime prevalence of anxiety disorders is about 7.3%. Now, if you can look at those confidence intervals in there, it means there's variability from country to country. Some countries have lower rates, like 4.8%. Some countries have higher rates. But on average, if you're thinking about how common anxiety disorders may be, about 1 in 14 people around the world at any point in time are experiencing an anxiety disorder. The 12-month prevalence is even higher, about close to 12%. And again, those confidence intervals are fluctuating. In fact, in some studies, we've found that, certain countries may have anxiety disorder rate reports as low as 2.4%, whereas others report rates as high as 27%. So there's a lot of variability in our studies of prevalence in different countries around the world. But, if we try to bring all of that information together in a summarized manner, about 1 in 9 people around the world have had an anxiety disorder in the last 12 months. Anxiety seems to be occur more often in women. It is less likely to be seen in older adults compared to people between the ages of 35 and 54. The most common anxiety disorder of all of them are specific phobias. And I think that's something people are more familiar with, like being afraid of spiders or birds or, one very specific thing. The next most common disorder are social anxiety disorders. And I think that's one that really goes undetected very often. And that's followed by generalized anxiety, panic disorder, separation anxiety, and agoraphobia. Next slide, please. So I'm just going to touch very briefly on a few of the anxiety disorders. There's a lot of information online, including on the National Institute of Mental Health website, if you want more information on the specific disorders. But just so that we have this one on our radar, generalized anxiety disorder, it's really an experience of overall anxiety and worry in various different domains about school, about work, about all sorts of different things that's happening most days of your life. And it's associated with restlessness, being keyed up, having trouble concentrating, all of these symptoms we've discussed earlier on. And in general, we see it last at least longer than 6 months. Probably that's also a threshold at which point people really start to feel like they need some help with it. Next slide. Social anxiety disorder, as I said, it's one of the more common disorders and often goes undiagnosed. It's characterized by a marked fear of social interactions or situations in which one might be scrutinized or the focus of attention. So oftentimes people think about performance anxiety when you have to stand up and speak in front of class. Or perform in front of an audience. But really this can happen in almost any situation. Eating in a public space might cause severe anxiety, or talking on the telephone where other people may be really focused on how you're answering. There's a lot of fear of negative judgment from other people, or being embarrassed or humiliated or rejected, or of offending other people. So a lot of anxiety thoughts about how the others have perceived you. Again, we've talked about some of the physical symptoms, and this, I think, social anxiety can really limit our ability to perform all sorts of functions in regular life. Next slide. Panic disorder. This is, many people talk about their experiences having a panic attack. So this is usually a very sudden experience where you start feeling your heart beating really fast, you're having trouble breathing, you feel like you have tremors, your hands are sweaty, and it's, comes for a lot of people out of the blue. It lasts a short period of time, 1 to 10 minutes. There are a lot of physical symptoms and, oftentimes associated with the fear that something really terrible is going to happen. You're going to throw up. You might be having a heart attack. Sometimes they wake you up in the middle of the night, and they can really be cued to specific situations or circumstances, or they can come kind of out of the blue. And there's a lot of fear of experiencing another similar attack. They're very distressing. Next slide. And the last disorder I'm going to touch on, again, this is no longer considered an anxiety disorder. It's in its own category of disorders now, but it's very interrelated with anxiety and associated to a lot of anxiety symptoms, and that's obsessive-compulsive disorder. So just to kind of generally keep track of it, obsessions are these intrusive thoughts that just come into our head. They're very repetitive. And they tend to be distressing. And compulsions are the things that we do in order to make those distressing thoughts go away. So you can think of one, related, for example, to germs. So you have a distressing thought that your hands are dirty because you've just touched a pen. And so you can't get rid of this thought. I can't even concentrate on this next thing I need to do because I have this thought in my mind that my hands are dirty and my hands are dirty and my hands are dirty. So the compulsion then will be to go and wash my hands. And because the thought is so intrusive, I might have to wash my hands multiple times in order to have the feeling that intrusive thought has gone away. Now, this can happen with any number of different types of thoughts, and it really becomes pervasive. It gets in the way of you being able to do pretty much anything. It takes a really long time. It might limit what kind of interactions you can have. I'm going to stop there, Lori, and I think I'm going to hand it over to you to start telling us more about what we can do when we're having these different types of anxieties.
Thanks, Anna. So let me just share my screen.
While Lori's getting set, let me just remind you, you can put questions into the Q&A box, and Anna and Lori will jointly take questions at the end.
So it's not showing up for my PowerPoint sharing. Can you share it and I'll do next slide for you?
Here we go. It keeps me really listening this way, so it's good for me.
Sorry. All right, so I just want to briefly touch on the importance of culture and anxiety. So, you know, culture impacts our anxiety from a number of different systems. And this is an ecological model oftentimes that we see in social work, which is that all systems are interrelated. So we have our intrapersonal, the anxiety that goes on within us, and that's impacted by our intimate culture of our families and our communities, all the way out to the macro systems of our society, our norms, our beliefs. And, you know, I think it's important to stop right here and just take a minute and appreciate that some of us and our anxiety are more impacted by the higher level systems than others, you know, based on discrimination or racial injustice that we've experienced, or you know, gender and sexism issues. So I just think it's important to note that our anxiety doesn't exist within a bubble. It exists within our culture, and we'll have a chance in the small groups to talk about that a little bit at greater depth. Next slide. So now we're going to talk a little bit about a few things that impact our anxiety, and then we'll really get into strategies. So the first thing is cognitive distortions and unhelpful thoughts. So if you want to go to the next. So this is a pretty classic, what we call the cognitive behavioral triangle. So basically our cognitions, our thoughts, impact our feelings, which impacts our behaviors. So we tend to think, oh, I feel this way, and then I act, and then I think about it. But when in reality, oftentimes our thoughts are the things that are coming first. And we tend to have characteristic ways of thinking called cognitive distortions that increase our anxiety, and they increase then the types of behaviors that we do. So you can just scroll through all of them. So there's one more. So all or nothing thinking is this idea, this type of unhelpful thought or cognitive distortion, that we are either perfect and everything is going to go exactly one way, or it will go the complete opposite way. Catastrophizing tends to be that idea that the worst thing will happen, right? So this even comes up even before we try something, right? This is going to go terribly, and that increases our anxiety and our worries. Mind reading allows us to think, okay, well, what is this other person thinking about me, without checking our assumptions. So we assume we know what other people are thinking, and generally in anxiety, we are not thinking that they're thinking something good about us. There's fortune telling, where we predict the future. So a lot of times I'll hear this in, I can't get started because it's not going to work, before we even try something. Discounting the positive, which goes along with maximizing and minimizing. Discounting the positive is saying, well, I had this evaluation and my boss said 15 really good things about me, and one really thing that I need to work on, but none of that other stuff counts, right? And that's also kind of maximizing. We maximize the negative and we minimize the positive parts. Another way that we discount the positive sometimes, or minimize, is that we say, okay, well, I'm struggling and the only reason I got here is luck, right? So we minimize all of the good traits that got us to where we are. We overgeneralize as a cognitive distortion. And I think really importantly also, we use emotional reasoning. So we say, I feel like a failure, therefore I am a failure, without checking the facts. So we use our emotions as the data without looking at any of the other evidence. Next slide. So this is a way of sort of conceptualizing it. So for an example, an unhelpful thought is, I'm not being as productive as I should be, and people are going to see through me. They're finally going to realize that I don't know what I'm doing. That increases our anxiety, our panic, our stress. which then leads us to do a multitude of behaviors. In this example, I put that we overwork and we work for 12 hours straight to make sure everything is just right, or we isolate and we say, they're going to know it's useless, I can't do it, I need to avoid it, as Anna was saying. And so, which makes us think, I knew I couldn't do it, which makes us feel more anxious, and we get stuck in a cycle. Next. So we're going to talk a little bit about challenging these thoughts, but you can see just the way we perceive and the story that we tell ourselves can really shift that cycle. So I'm hearing a lot about productivity, right? I'm not as productive as I'd like to be during the pandemic. Well, the shift in cognitions could be, this is a slow period, right? I have this job because of the hard work I've done to get here. And yeah, the truth is I haven't done as much as I wanted, but maybe I'll focus on what I can do now, and maybe I can reach out and maybe I can get help, right? Which then we're still going to feel uneasy and uncomfortable. No amount of cognitions, like Anna said, there's some adaptive anxiety. We're still going to feel a little uncomfortable that we're not at the place we wanted to be, but maybe even part of us might feel relieved, or okay, maybe I can do this. And there's some more motivation and some increased performance there, which then might lead us to healthier coping, to reaching out, checking in with others, working on what we can, which then is going to increase our helpful thoughts once we are able to modify some of these behaviors. Next. So now we're going to talk about perfectionism and anxiety. So perfectionism is one that we see, I think we talk about a lot in the biomedical community, and it's a really important piece of something that drives a lot of our anxiety. Next. So Brene Brown she's a clinical social worker researcher. And she discusses this idea of perfectionism. She studies shame and vulnerability and worthiness. And she defines perfectionism as this armor, this belief that if we can do everything perfectly and we can look perfect and we can act perfect, then we can avoid those feelings of anxiety, of blame, of judgment, of embarrassment, of shame. So we strive often for perfectionism, and a lot of times the underlying goal is to avoid that underlying discomfort and that underlying fear of shame and blame and judgment. So it's a protector. Perfectionism is a protective factor, right? So it has really good intentions, but the truth is it doesn't really work that well as a protector. In fact, it often increases our anxiety. So what happens is we strive for perfection. And then inevitably, as life happens, we feel disappointed, or we make a mistake, or someone gives us a comment that we weren't expecting, or an edit that we weren't expecting. And then instead of saying, okay, that makes sense, or this is life, it happens, our perfectionism tells us, this is you. You didn't work hard enough. It wasn't perfect enough. You could have avoided this. So then what happens is we feel anxious and we want to drive more towards our perfectionism. Next time I'll work a little harder, or I'll do a little bit more to avoid this feeling that I'm having right now. It also does another thing, which is it keeps us in the dark. When we feel like, okay, I wasn't perfect, there's something about me, then who would want to go to someone and say, hey, I'm struggling with this, or I need a little bit of help, or can we talk about this, right? So it keeps us in our anxious thoughts more, and it keeps us hidden often. And then we lean more into that. I've got to avoid this feeling. It's got to be just right. And so the cycle goes. So we're going to talk a little bit about the things that we tend to see in perfection. We're also going to talk about how we can move away from perfectionism towards healthy striving. So behaviors in perfectionism that we often see, we tend to see extremes, either extreme overworking or often avoidance. So maybe we overwork and we overplan because we want everything to be exactly right. We start over and over again. That often makes us disorganized, right? Because we try to pull in every possible scenario. What if this? What if that? And then what happens is we have too much. We get disorganized, and then we feel like we can't start. So oftentimes we'll see procrastination and avoidance of the task at hand, but also avoidance of people. Like I said, you don't want to go to somebody and say, hey, I don't know what I'm doing, if the primary goal is to avoid that judgment, right? Or to avoid, hey, what are people going to think of me? Are they going to realize I don't actually know anything about what I'm doing? So we isolate ourselves, we stay in our anxious thoughts, and we tend to ruminate on them. We compare ourselves to others often in perfectionism. We say, okay, well, they seem to have it all together, so I certainly can't ask them, or everyone else is working at 100% all the time. I have to work at 100% all the time. We don't ask for help and we hide. And we can even get to the point of lying, right? Hey, how's that paper going? Oh, yeah, I'm working on it. I'll get it to you tomorrow. And maybe we haven't even started, right? And we abstain from taking opportunities and calculated risks. So we feel like everything has to be perfect. It's going to be really hard for us to say, you know what, I don't quite know that I can do that opportunity, but I'm going to go for it. I'm going to try and learn and grow, because we're afraid of that. Next. So these are a lot of the unhelpful thoughts, the cognitive distortions that I spoke about earlier, and they show up pretty heavily in perfectionism. Right? They show up all across the anxiety disorder spectrum, as Anna was talking about, but they really show up in perfectionism in these types of ways. So I think it's important to talk a little bit about imposter fears, right? We minimize the things they don't know that I don't know what I'm doing, and so therefore I have to be perfect so that they don't find out, right? Or we hyper focus on the critical feedback, and we don't necessarily focus on, oh, well, actually they said, it was pretty good and it has a lot of potential, but you need to just work on these 3 things. We ruminate, so we think about our mistakes again and again and again, and that becomes then really hard to move on and try to just do things good enough. And we have a fixed mindset about it, so it's never going to work. We're going to talk a little bit about growth mindset in a future slide, but our fixed mindset says it's never going to work, versus our growth mindset, which might say it isn't working yet. We become very hard on ourselves and overgeneralize. We start to have emotional reasoning of, I feel like a failure, there I am, therefore I am, or I don't feel like it's perfect, therefore it's never going to work. We have this all or nothing thinking. Oops. You go back one more. The all or nothing thinking, I think it's really important that we just hit on, I should be doing this, I should be doing that, I shouldn't be doing this. If you hear yourself saying a lot of shoulds, it might be a cue that you're experiencing some of that, and a lot of the what ifs, right? Because if we are trying to avoid all possible mistakes, we say, what if this, what if that, what if this? And it's our brain's way of protecting and planning, but we get so stuck in the what ifs, we can't then move on, right? Next. So of course, then all of these feelings come up, right? If we're thinking about that triangle, if those are all of our thoughts and our behaviors, then these feelings come up. And of course, anxiety will come up. You might even start to feel a little bit hopeless, like, how am I going to move forward on this project? I don't know how it's going to get done. So there are probably a lot more emotions too that I don't list on this slide that come up from perfectionism. Next. So this is really important to sort of slow down and think about this, right? Because we've just heard about how perfectionism can hinder us, right? It hinders us from getting things done. It hinders us from moving forward, right? But we don't want to give it up, right? We don't want to, as this cartoon says, we don't want to drop the rope, because there are several reasons. One is maybe we feel like perfectionism has gotten us to where we are, right? We've worked this intensely and it's helped us get us to where we are, right? So we don't want to give that up. Or other people seem to have it all together, so I should be able to do this. And I'm really in a competitive environment. And, I think we need to acknowledge, speaking of culture, that there's a competitive environment in the biomedical sciences. And so we don't want to be the person who says, okay, well, I'll give up perfectionism, but the 6 other people who are interviewing for the same position haven't, right? So that feels pretty scary. I think there's also a fear of, if I am not a perfectionist and I don't drive myself really hard, then I'm going to be too easy on myself, and then I'm not going to get anything done. And that's actually an example of all or nothing thinking, right? Either I strive and I work myself to the bone and I burn out, or I'm going to get nothing done. There's something in the middle, and that's healthy striving, and we're going to get there. But the thing in the middle is, I can try, it's good enough, I can put the project out, I can ask for help, right? Is there something in the middle, a way to motivate ourselves that isn't this perfectionism potentially? We have imposter fears, and it makes us feel really vulnerable and embarrassed to feel like, okay, I could make mistakes. And then also, we're not sure we can manage it, right? A mistake comes, I don't know that I can handle that. Either I don't know that, my career will survive it, or I don't know emotionally that I'll be able to handle it. So this type of perfectionism leads to a very specific cognitive behavioral triangle, right? Where we feel like it has to be perfect. This is all my fault. I'm a failure, right? Which leads us to all of these feelings we discussed. And then the behaviors, which are overworking and avoiding, sacrificing the good for the perfect, not reaching out, getting stuck, not finishing the project. And also part of this cycle is that others, because we're not talking about it, others are led to their own conclusions. They don't necessarily see all of this. They just see, they're not getting their work done, and I'm not sure why, right? So we're going to talk about some strategies around that. So next slide. So healthy striving. So we're not saying, okay, well, stop being a perfectionist and just stop caring about everything, right? Healthy striving is the idea that I can care about something and I can make a mistake and I can grow from it, right? We're not saying, oh, I'll give it up, just take a break, relax, don't do anything, right? We're saying healthy striving is we can acknowledge that mistakes are part of learning, and that perfectionism is not really that realistic of a goal, because always things that we're learning and growing, and that's how we grow, and that's how we learn to handle them. Like Anna was saying, the anxiety curve gets shorter and shorter as we expose ourselves to these things, and we get less and less anxious as, oh, I made a mistake, and then I see, oh, well, it's manageable, I can handle it. And that's growth mindset. And Carol Dweck has a wonderful video about the power of the yet that's linked at the bottom here. Other benefits of healthy striving, of this mindset, we reduce that time, unproductive worry and planning. We reduce our disorganization and our anticipatory anxiety, because we think, okay, well, let me plan it a little, but then I'll be able to handle it if things come up, versus I can't handle it when things come up. We reach out to help, we connect with others, we get that critically important either mentoring or support. We take risks and move towards our opportunity because we know we can handle it, and we have a support team in place. This is pretty important. We detach our self-worth from our productivity and our output. So when we have a growth mindset, we can sort of detach ourselves, and we can say, you know what, just because this thing didn't work out, that doesn't mean that I'm not working out. And then this is a more healthy sort of triangle of, I wish it were perfect and I'm nervous. And yeah, again, I wish that it went a different way, but I think I can talk to somebody and I'm pretty sure I can get through it. You're still feeling comfortable. You'll still feel uneasy when mistakes happen, but you may often feel relieved, motivated, and maybe even proud that, like, okay, I can handle this. I can get through it. Next. So the last thing before we really get into strategies is these self-compassionate core beliefs. So this is a strategy actually, but Kristen Neff does a lot of research on self-compassion, and a really helpful way of moving from perfectionism to healthy striving is to think about self-compassion, which is essentially just being kind to ourselves, right? The saying is, if we talk to other people the way we talk to ourselves, not a lot of people might stick around. So talking to yourself the way that you would talk to a friend, and these are just some examples, but I think a couple of the ones that I really want to point out are, my value does not depend on everything being perfect. My productivity does not equal my self-worth. And everybody has hard times, and I'm valuable even if I make a mistake. So thinking a little bit about self-compassion is a good strategy. So you can go to the next one. So the question to ask ourselves as we're trying to decide what strategies to use are, how am I functioning and am I suffering? So we know anxiety becomes an issue when it gets in the way of what we want to do or what we need to do. And when even if we are functioning, if we're suffering greatly. I can get my email out every day, but it takes me an hour to write an email, and then I go back and read it 4 times to make sure everything was perfect, right? Well, I'm functioning, I'm sending out all the emails I need to send out, but I'm suffering and it's really hard. Taking care of ourselves, we usually think, I will take care of myself once I've been productive for the day. But taking care of ourselves is part of productivity. We all know those days where we sit and we stare at something for 7 hours and we don't take a break, and we think, I'll take a break when I'm done with this, versus the days where we say, all right, I've been looking at this for 2 hours. It's not really going. I'm going to go take a walk, get a cup of tea, take a few deep breaths, and come back, right? It's part of productivity. And I understand that, this takes some culture change, but it's a critical part. And when we are resistant to taking care of ourselves and using these tools, that's usually when we need them the most. So I break it down. I think that we hear a lot of tools about anxiety management. Take a deep breath and go for a walk and challenge your thoughts. And I break it down in my practice in these 3 ways. So first, we want to relax. So we relax that physiology. We can get our bodies down so that we are feeling in a little bit of a calmer state. Sometimes we need to distract ourselves if we're ruminating and we're really stuck on something, to sort of shift our mind, distract ourselves from it, which is different than numbing. Distraction is I'm going to do something that fills me up, that makes me feel good, that I can then come back and deal with the issue, rather than I'm going to spend 8 hours on TV so I don't ever have to come back and cope, right? And then cope. So relaxes our physiology, and we'll talk a little bit about specific strategies. Distract, there was a list there of all the things you could do to distract yourself, and cope. So cope is dealing with the worry head on. So we can talk to somebody, we can recognize and appreciate our thoughts and talk back to those negative or unhelpful thoughts, make a plan and move towards acceptance and move towards resources. So we're going to get into some specifics of each of these categories. So next. So these are 6 powerful tools. This is from data from the ACEs study. So it's protective factors from childhood trauma. And we know that these are really helpful. So whenever I'm struggling with anxiety, I go through my checklist. All right, how's my sleep? How's my exercise? How's my nutrition? Am I using mindfulness? Have I checked in? Where are my healthy relationships? And do I need to reach out for mental health? And this is a pretty good starting checklist. Next. So next, we're going to talk a little bit more about specific strategies for relax, distract, and cope. So here's some deep breathing techniques. These are really useful. There's a lot of different kinds of deep breathing. So 5-finger breathing is, we can sort of start at our bottom of our 1 finger and breathe in and out, in and out, in and out, in and out, in and out. Right? And that gives us some tactile relaxation, right? This is the relaxed part. We can do box breathing, which is you just imagine a box in your mind and you can draw it. Breathe in, hold, breathe out, hold. Same thing with the star. 4-7-8 breathing, as we breathe in for 4 seconds, we hold it for 7 and breathe out for 8. Smell and blow breathing is really good for little kids. That's sort of, you can say, smell the hot chocolate and then blow the steam away. We also do it for birthday candles, when you used to be able to blow on a cake and then pass it around. Not so much anymore, but it's a good image. Dragon breathing, which is different than yoga dragon breathing, but this is another one that can be helpful as we sort of relax our jaw and breathe out really hard, and you can even make it sound as if you're blowing out fire. Breathing with imagery can be helpful. So you imagine you're breathing in cleansing air and breathing out your stress, or with a mantra, right? I am calm, I can handle it, whatever your mantra is. Belly breathing with or without an object. So you can put your hand and feel your belly fill up like a balloon, or for little kids, you can have them lie on the floor and see put a toy on their belly and have them watch the toy go up and down. And then guided meditations, focusing on breath, which you can find online. And any of these things you can find videos for online too. So grounding really helps us. It's another relax. When we're in our minds, when anxiety, we're usually in the past or in the future. We're worried about something we did or that happened, or we're worried about something that's going to happen. Grounding brings us back to the now. So we can think of 5, 4, 3, 2, 1 is a wonderful grounding exercise. It literally forces you to look around you and name 5 things you can see, 4 things you can feel, etc. Other grounding exercises to bring us back to the present and help us calm our body down, which are really, really helpful during those sort of panic moments that Anna was talking about, is any kind of shift of your senses. Taking a walk, taking a shower, chewing on an ice cube, holding a warm cup of tea. Something like visual is that you could focus on a picture, close it and see, can I remember where 6 of the things were? Progressive muscle relaxation also forces us back into the moment. We basically go from head to toe or toe to head, and you squeeze each muscle group and release. If you're in a meeting, you can also just do it with your hands, and it helps us focus on the moment. So this starts to get into cope, right? So focus on what we can control. So as we're thinking about how do I actually cope and deal with this anxiety, oftentimes anxiety lives in this yellow circle. What I wish I could control, but I can't, right? So my example is always the start of the pandemic. I was very worried we weren't going to get our Amazon packages. That's how we were surviving. And I realized I have no control over the Amazon distribution center. So I better focus on what I can control, right? I wish I did, but I don't. So focusing on what we can control and sort of starting to make a list. What can I manage and control in this moment? Next. So this is dialectical behavioral therapy, which is another therapeutic treatment, is that there are, sometimes when we feel particularly stuck, we say, there's nothing I can control. Well, actually, there are always 5 ways to deal with the problem. So we can solve it, we can change how we feel about it, or radically accept it, right? This person is, they've been in the field for 45 years. This is how they do it. I'm not going to change much about it. I need to change what's going on for me. We can continue to stay upset about it. Or we can make it worse. We can say, I'm really anxious, so I'm going to send this very long email right this second. And then we realize, oh, maybe the choice was, I just made it worse, right? So there's always different choices that we can make. And that actually leads us very nicely into the stop technique, which I really like, which is just when you're feeling anxious, stop, take a breath, open and assess all your choices, right? You've got a lot, often more choices than we realize when we're anxious. When we take a choice, which might also mean one of the choices that we have might mean that we need to acknowledge that, hey, maybe this is more of an unhelpful thought than it is, a realistic danger. Collect all the evidence that you have and come up with more helpful alternatives. Now, this can be really, really hard. So I often find it's really helpful to do this in the presence of a trustworthy other person, right? If we're really anxious, it's hard to see the other evidence. So calling someone that you trust and connecting with them can be helpful to do this. Next. So this is really important, and I want to take a minute really to talk about it, which is that there are safe and effective ways to get professional help. So therapy is incredibly, we know from the research, can be incredibly helpful, like Anna said, to treat anxiety. It helps us deal with this in a safe, supportive, non-judgmental, confidential environment. And I was, sort of thinking about it this morning and reminded that it's also an impartial person sometimes to have these conversations with that have no stake in the decisions that you make, that can help you sort of think things through in this impartial way. It helps if you really ask yourself those questions and you say, I am really suffering, or I am really struggling with functioning. This is really an important thing to consider. You get to practice skills and you get to do it at the pace that feels right to you. And I want to ask Anna, do we talk for a minute about the medication part of it?
Sure. I think it's important for people to know that there are medication treatments as well as therapy that can be helpful for anxiety. The primary treatments for anxiety are selective serotonin reuptake inhibitors, or SSRIs. They're also commonly known as antidepressants, although that's not the best label for them. They are the primary treatment for anxiety disorders as well. There are other types of medications that can be helpful depending on the type of anxiety you're experiencing. I think it's really important to know that a lot of our primary care providers in the community are, feel comfortable prescribing these medications. They're certainly able to prescribe them. And so if you're feeling like your anxiety is very intense and that you would like to discuss it with your doctor, feel free to reach out to your primary care provider unless you already have a psychiatrist or one easily available.
So when you're seeking therapy, there's some factors to consider. We call them goodness of fit, right? But what time do you need your session? There's therapists that work during the day. There's therapists that work at night. There's therapists that work on the weekends. Where do you need your therapist to be? Oops. Where do you need your therapist to be is a big one. Do you need someone who takes your insurance, or can you get reimbursed later? Personality, language, modality, like would you like a couples therapist, or they have family or individual? And also identity specifics are really important to mention. So are you more comfortable with somebody who specializes and understands or even has the same identity of LGBTQ+, or racial identity or cultural or language? So it's something to really think about. And there are therapists out there that can match those goodness of fit things. A note on stigma, we understand that there's stigma, and I think it's important to say there's more stigma in certain cultures than others, right? And so we understand that, and it might be worth putting that aside, or even talking to the therapist about that stigma and that fear, right? That's what they're there for, is to be able to talk about those things. There's just some resources. There's resources in your own communities, on your own campuses and institutions, in your own communities. So, and some supportive and inclusive websites to find a therapist. So lastly, I just want to close with this, that when we're thinking about anxiety, sometimes it feels like our logical mind and our emotional mind are battling each other. But we think about this idea of wise mind, which is we want to be able to use our emotions and to use our logic. And sometimes we lean more heavily on one than the other, but our wise mind often is the one that sort of helps us with managing some of that anxiety.
Thank you, Lori and Anna. There are a lot of questions, and there are a few of them, well, right in a row, a number of them upvoted 25 or more times about whether it's appropriate to disclose or discuss struggles with anxiety and perfectionism with your supervisor, if you're a student, with your thesis advisor, your PI, et cetera. And I think I'm going to answer that one quickly and say the context really matters. Some bosses and supervisors are very, very supportive, and you might feel comfortable sharing immediately. Others are not, and you might want to talk with other trusted people at your institution to figure all of that out. We will, for those of you who are students, and the one from students about your PI was upvoted 26 times, the webinar in February on mentoring relationships is followed by small group discussions, and I will in that talk spend a lot of time talking about assessing the safety of sharing. And hopefully we can talk about that a little bit in the groups. Something here, Anna, that was asked multiple times is your thoughts about why women struggle with anxiety more than men. And
I think that's a question we're still answering through research. There were some questions I skimmed a while back, also asking about, do hormones have something to do with it? We certainly are looking into that aspect of the neurobiology. And definitely hormones relate to mood and anxiety states. So we think that definitely has something to do with it. There's a variety of different studies that are evaluating why these differences occur. I would also add that we've touched a little bit on culture. And I think that, some of these examples of how different the prevalence in anxiety is in different cultures, I think in the studies of the 44 countries, in Italy, the rates were 2.4%, and in Mexico, they were 27.6% or something along those lines. I think the takeaway there is also that there are different idioms of distress that are culturally acceptable in different cultures. I think that also plays a part into, what is a manifestation that's expected or allowed, or, an expression of distress that in your culture may be appropriate. So I think there are many things that are related to why we're seeing this. And some of them definitely have to do with neurobiology. And, I'm wondering how much, of them also have to do with culture and what's acceptable.
Yeah. Another question on a different topic, and that is, there were several about how to talk to children or young adults specifically about anxiety, but then others which were just in general. How do I support my spouse, my coworker? Like, if you are observing anxiety in others and want to be supportive, what might you do?
I'm happy to start. And then Lori, I think Lori has just walked us through a whole series of different strategies that any of us can use or can share when we're seeing people experience anxiety. I think as we're thinking of kids, one of the things that's important, if we go back to remembering how avoiding anxiety-provoking situations ultimately makes our anxiety worse, one of the things we want to do as we're working with our kids is to help them slowly take risks and not be afraid of failing or making a mistake, right? And to do that in a gradual manner. I think that the very important part of anxiety is that we know that if we, are worried about something and then suddenly choose the scariest thing in the spectrum of scary to, try to confront, that's just going to be really overwhelming and actually may feel very traumatic. And it's not going to help us try to, face things that are making us anxious. So usually with kids, if they're experiencing a lot of anxiety around certain things, we want to find a way of making it feel okay to make mistakes and to fail, a way to help them learn how to calm their bodies using the strategies that Lori taught us, and then to slowly encourage them to, try out these things that are a little bit scary. And you can do that in a gradual way. And I think that that will ultimately help overall, our kids be less anxious of any type of problems that may arise.
As you were talking, I think you could take kids and remove the word kids and put in our staff, our trainees, right? I mean, the idea of practicing in safer ways is maybe there are a lot of questions about how do we decrease perfectionism and anxiety in research spaces, and what you just said could be, right, transferable to that environment. Lori, do you have anything to add on the way out of that question?
Yeah, I just think that it's important to come in with a curious attitude, because if we come in, it's not that big of a deal, or it's fine, or you'll be okay. We want to reassure people, but to come in with a curious attitude makes it even safer than to say, actually, I am really worried about this or that. And so that can be an incredibly helpful thing. And know that sometimes we are resistant to the people who are closest to us trying to support us in that, right? So the more curious and the more open and the more we say, I've dealt with that too. And that's the thing that can help normalize.
Thank you. There are a lot of questions about using some of the strategies that you discussed in terms of how to address cognitive distortions. And I think that rather than go through a lot of them, I hope that they will come up in the groups, which is really where we're heading towards. I also want to stress that the Becoming a Resilient Scientist series has a full 2 hours on cognitive distortions, a full 2 hours on emotion in the workplace, a lot about assertiveness and communication between supervisors and trainees. And many of the questions relate to navigating distressing situations around developing scientific skills and expertise. And so I hope you'll check out some of these other resources. I'm sorry we don't have that much time for questions today, but I think it's important to stay on schedule. We will be transitioning to small group discussions where you will have a chance to talk in a group that is facilitated by a mental health professional here from the DMV area. We hope that you will log off of this Zoom and onto the next one. I want to say this is a standard slide. It says, please turn on your camera and participate. We just talked a lot about social anxiety, and we would rather that you join and leave your camera off than choose not to join. This is a supportive, we hope supportive place for you. If that, as you were listening to that section, it resonated, this is a place for you to come and try to be in the group. No need to share, but we hope that you do. The stories and the discussions are private. We will not be taping. This is taped and you can watch it again, but once we get into the small groups, there is no taping. Please, if you're an extrovert, remember not to dominate. And if you're an introvert, maybe take a deep breath and try to share a little bit so we learn from you. The link to get to the groups is here. Go ahead and snap a picture. Or jot down the meeting ID. A lot of people come to the talk and many fewer people come to the small groups, and I get that. It's asking a whole level of vulnerability to show up at a small group. But the honest truth is that as we talk to students and staff about these activities, they acknowledge that they are really taken by the learning that happens in the group and the sense of community support. And we are all so distanced right now. So maybe take a walk on the wild side and think about joining us. Let me thank Anna and Lori. From the questions, it's very clear to me that we need to add additional resources and webinars to this series, and we most certainly will. So thank you all for being here. The meeting ID for the small group discussions is 161-8237-9760. Thank you very much for joining us. All right, we'll see you on, I'll see you on the next one. Anna, thank you very much.
Thank you for having me.
Oops, I forgot to stop